Hi, I'm Amie Meditz. I'm an infectious disease specialist, and kind of to start off with, I hope that everybody out there can see how heartwarming it is, this multidisciplinary approach to the safety of our hospital here. And that, based on this presentation, this is just, just the part of the team approach that we're taking to the hospital to make it a safer place to come to get your care. So this has obviously been approached by all of us here, but proper personal protective equipment really equals protection for all. All of our employees are required to wear surgical masks, and I want to let everybody in the community know we were early adopters of this in this pandemic. We put masks on our employees very quickly, and it wasn't easy. People didn't necessarily welcome it with open arms, as people have seen a lot of different responses just in the community. We have come to recognize the true importance of wearing a mask. We also have our employees wear eye protection when caring for all patients. And what I want to try to convince you of is that the safety of our healthcare staff really transmits straight to the safety for you. Because if our staff is healthy, they're not going to transmit anything to the people that we're caring for. So really, they go hand in hand. So this is my favorite topic, that masks are effective no matter what is said in the media. If a mask is worn properly over your nose and your mouth, it's effective at preventing the transmission of COVID-19 as well as other respiratory viruses. This year in the Southern Hemisphere, the rate of influenza has been very, very low because everybody is wearing a mask. Using a mask, distancing, and hand hygiene, this is not fancy technology. Like, we're all interested in the robot that might be used in surgery or our new fancy watch. This is old technology, but it is effective technology and is basically one of the main pillars that we're using to control this pandemic. So this is a little bit more detail about what we're doing when patients are admitted to the hospital. I do hear from my patients, oh, I want to do everything I can, I don't want to be admitted to the hospital. But what I want to assure you is the hospital is a safe place to be admitted. So I want to try to give you more information about what we're doing to help you feel more reassured about that. So first, our patients who have COVID-19, we rapidly identify them. We have an in-house test that identifies that they are infected in less than 2 hours. This is a great difference from the beginning of the pandemic. It was taking a week to identify these people. So this is a huge advance to the safety of our hospital. All of our patients have private rooms. This is not new to this pandemic. We've had a private room-based hospital since the hospital was built. And this has been an important basis of all of our infection prevention practices long before COVID-19. Our patients also are asked to wear a mask on admission when interacting with their healthcare team and when leaving the room when they're being transported, because source control is another important part of preventing transmission. And as everybody is probably aware, infection can be without symptoms, and it's kind of one of the Achilles heel of the pandemic. So having a patient wear a mask is another measure of preventing transmission in our hospital, all patients. Specific to our patients with COVID-19, we minimally take them out of the room. They are clustered in a single area of the hospital. And again, our healthcare personnel wear specialized personal protective equipment. Again, this trickles down to safety of other patients and our employees, preventing the infection of our healthcare personnel prevents infection to others. So you may be wondering, we're a small community hospital, but we have all the standard therapies that are available to patients with COVID-19 that larger hospitals might have. So we have ICU care, we have ventilators, we have medications, we have convalescent plasma, steroids, remdesivir. This didn't just fall into our laps. This was the result of the work from my partners at Beacon Center for Infectious Disease, the pharmacy, the administration, the pulmonary team, the anesthesia team, and many others at Boulder Community to make this happen at our community hospital, to be able to take care of patients who become sick in our community. So this is a chart about the testing that we've performed at Boulder Community Health. Now, this is the testing that we use when we swab your nose. It goes into your nose and we collect the sample. This is measuring the virus directly. It's called a nasopharyngeal swab. It's a little uncomfortable. It lasts for about 30 seconds total. And this chart is kind of displaying what we've done. We've almost collected 14,000 swabs. And to give this a context, this has been about 30% of the tests performed in Boulder County. We're very proud of that accomplishment. This chart is divided into the reason for testing. There's a concern for COVID-19. This would mean somebody has symptoms, they might have had an exposure. It could include people that are wanting testing because of travel reasons. That's this top category. And I've divided that into two things. One is people that are getting admitted in the emergency room or urgent care. These are more likely to be people with symptoms. I mean, they're going to those areas for a reason. And among those people, the percent positive is 8.6. And you compare this to the community drive-through testing. So we got community drive-through testing started on May 7th. They've tested over 7,000 people, also something we're super proud of. And the percent positive is a little bit lower, but this is a more heterogeneous group, not all symptomatic, so you expect a lower percent positive. If you take these together, this does, of course, track with the percent positive that we're seeing here in the community. The second category is asymptomatic screening. So at the end of April, to get surgical cases going, we started pre-procedure screening of scheduled surgeries. Now, I want to be clear. We're screening these surgeries not because we can't handle operating on somebody who might have COVID that needs it. We have protective equipment. We know how to handle this in the operating room. We're screening people because if you have COVID-19 and don't know it and you have an operation, that operation could have a worse outcome due to that. So we've screened over 4,500 people, and only 14 people have been identified, reflecting a fairly low percent positive. Again, this does reflect our general community's lower rate of infection due to the things that you guys are doing and wearing masks and keeping physical distancing. We're also testing all women who are being admitted for delivery of their baby. This is kind of what it looks like. And just for a point of reference, in the last 7 days, we've identified 14 new positives. So among those cases that I mentioned that were identified, and admitted to the hospital, we had 65 cases hospitalized at Boulder Community. When this graph was made earlier this week, we had one that was admitted to the hospital. We've had a death rate of 12%. And just to be clear, the majority of these individuals elected to not have escalation of care. They didn't want to be taken to the ICU or put on a breathing machine. They just elected to let nature take its course. But then you can see the majority of individuals were discharged. We had 2 cases that were transferred to a higher level of care because they had they needed a special type of support that we couldn't offer them. This is a rare instance to need this. So This is a little off topic regarding the safety of our hospital, but because it's such a pressing question and people get nervous that we're testing people and it's not really reflective of, that it's accurate. But I want to assure you, our testing is accurate. It is good. So this is a graphic, and on the left is where the droplet exposure occurred. So that means you just got exposed to somebody who had COVID-19. That's day 0. So the average time to develop symptoms is 5 days. So just to kind of put this all in context, you can see the little viral particles are getting more abundant as you reach to day 7. That is the peak amount of virus that you'll have in your nose. And it's millions of copies. The tests that we're using at Boulder Community detect 5 to 500 copies. So millions are in there. So we only need 500 to detect. So the test is accurate. The other thing I'm taking you to the next level with this graphic. If you see more to the right of this graphic, the pieces of virus are breaking apart. They're just pieces of virus. What I'm trying to show here is that after day 9, there is robust data showing that you're not infectious anymore. But there's these pieces of virus that remain in your nose for up to 3 months. So testing people to show that the infection is gone is actually not that helpful because the test is just measuring the genetic material, not if the virus is still infectious. So that's another point that a lot of people have questions about, that they get a lot of anxiety because they're still testing positive. We're not testing people anymore after they've been identified as positive for COVID-19. So admittedly, there's some small chances of false negative testing. This could be poor sample technique. At Boulder Community, all of our testing clinics, the staff is highly trained on how to do this properly. As an infectious disease staff, we trained these people, the staff, to collect this properly. You could collect the sample at the wrong time. So if you were exposed today, getting a sample today is not going to be helpful. Another reason that the test could be falsely negative is the infection's actually in the lungs and not up in the nose. This is mostly implicated in people who are admitted to the hospital. There can also be lab errors. This is true for any test, but we have a certified lab. We have a very standardized process for labeling. This really occurs very infrequently. I just wanted to show you a picture of what our testing clinics outdoors look like. These are the signs, and people pull into the parking lot, and there's a whole instruction process with signs and everything. It goes really smoothly. We actually test up to 9 people every 10 minutes. So it's a pretty quick process. It does require an appointment. So I'm also going to talk about another common question about what is the difference between quarantine and isolation. This is a common community question, and it is relating back to the safety of our hospital, because if our staff has an exposure to somebody with known COVID-19 outside of work even, if they meet this criteria, they have to quarantine. And what quarantine means is that you were close to this person, less than 6 feet, for more than 15 minutes, and they had known COVID-19. You have to quarantine for 14 days, stay at home away from others, measure your temperature. You may note that there's no masking mentioned here, and that's because the CDC has some uncertainty about the general public's ability to wear a mask properly. Even if people are wearing masks, their risks, if they were closer, is probably greatly minimized, but this is what the guidance is out there. But if one of our staff has an exposure, they will not be coming to work. They'll be quarantining based on this CDC guidance. Isolation, on the other hand, is when you are known to have COVID-19, either based because you had a test and you didn't have any symptoms, you were being screened for surgery, for example, or you actually had symptoms. Then you stay at home for 10 days, and if you had symptoms, you can't have a fever for 24 hours. Those numbers, that number 10 days, you may know has changed over the time of this pandemic, but now we know after 9 days, you're not infectious. So that's how that number got reduced. So BCH is a safe place to come. We know how to manage infectious diseases, and we've been doing this long before COVID-19. We just had to scale up what we were doing. But I want to emphasize what everybody else has emphasized. Do not delay care. It's kind of a unique thing for an infectious disease specialist because COVID-19 obviously can cause a fever, but there are many other infectious diseases out there that cause a fever. And they could be life-threatening, and you have to come in to seek evaluation. Cancer screening is another thing that is important not to delay. I have a personal story that I have a higher risk of breast cancer, and it was time for me to get my MRI a couple months ago. It was a very smooth process. I checked in from my car, I walked into the hospital, I got my screening questions, I wore my mask during my MRI. I felt very safe the whole time. Finally, of course, an infectious disease doctor is going to mention this, you cannot delay vaccines. Preventable diseases such as influenza are important to continue to seek vaccination. Here on the right, I want to encourage the Boulder County to keep it up. It's just been so heartwarming to live in a community that really is supportive of our hospital, wearing a mask in public places, physical distancing by 6 feet, avoid the crowds, meet up with people. It has to keep it down to less than 10, be outdoors, and use your hand hygiene. Here is me, Alicia Maltzman, and Mark King finishing the Be Strong ride, which raises money for the Integrative Center at the Cancer Center after we had finished our virtual ride. Well, that wasn't a virtual ride, it was our on-demand ride. So I appreciate your time, and thank you.